Greetings. Let us learn about bile leak. Here is a case of a bile leak, and when does this happen? Let us start with the normal anatomy. Here is a normal liver, bile ducts, and gallbladder, everything intact. And when a patient has gallbladder disease, we recommend cholecystectomy, that is, removal of the gallbladder. And this can happen in patients who have had a normal gallbladder with a stone that caused biliary colic, and the gallbladder never got inflamed. So we went ahead and did cholecystectomy, and in this case, the gallbladder looks relatively okay. On the other hand, if the patient has cystic duct obstruction and inflammation of the gallbladder, otherwise known as cholecystitis, again we do cholecystectomy. In this case, the gallbladder may look a little bit inflamed. And what are the complications of cholecystectomy? So when you do a cholecystectomy, you cut the cystic duct and secure the cystic duct with clamps. For the majority of the patients go home without any problems. Otherwise, no bile leak. Sometimes the cystic duct stump clamps may reopen and result in a bile leak from the cystic duct. This is the most common cause for bile leak after cholecystectomy, or cystic duct leak is the most common reason for bile leak. In addition to cystic duct leak, the leak can happen in other places of the bile duct or the common hepatic duct. So here, sometimes as a surgeon is trying to remove the gallbladder, there may be accidental damage to the hepatic duct, and the hepatic duct might leak or hepatic duct leak. In other cases, there could be an aberrant duct, that is the duct of Luschka, that goes into the gallbladder fossa, and as you're dissecting out the gallbladder bed, this duct could be damaged and a bile leak can happen from the duct of Luschka. Again, sometimes the right hepatic duct could be very close to the gallbladder bed, and as the gallbladder is being removed, there could be accidental damage to the right hepatic duct and a leak from that site. So we have learned about bile leak that can happen after cholecystectomy. A most common reason is a cystic duct leak. In addition, leak can happen from the common hepatic duct, duct of Luschka, and right hepatic duct. So let us see, how do these patients present to us? Patient undergoes cholecystectomy, goes home, and after cholecystectomy, within the first few days, they can come back with abdominal pain, nausea, vomitings, bloating, and when you examine, they may have ascites. And when you do an ultrasound or a CT, they may have findings of ascites, or a fluid around the liver and the gallbladder fossa. And these findings indicate that the patient has developed a bile leak. So the diagnosis here is bile leak. And in this case, you take them to ERCP and put a stent to fix that bile leak. We will learn about that later. Thank you.